The federal government says it is committed to revamping the healthcare sector in Nigeria with commitments from funding to building more primary healthcare centers, including the training of more healthcare workers in Nigeria. During this ministerial press briefing in Abuja, Health Minister Professor Ali Pate highlights further plans by the government to better the sector, including a 50 billion naira fund to be released soon as a first tranche of the Basic Healthcare Fund to ensure that quality healthcare is accessible for all Nigerians.
We are laser focused to improve the primary healthcare system with interventions, preventive and curative interventions that will improve health outcomes, as well as our hospitals. We're expanding the primary healthcare centers that are benefiting from the Basic Healthcare Provision Fund from 8,000 that existed until now, some of which are not entirely fully functional, to make them functional and expand them to 17,000 by the end of 2027. And we've had discussions with the Governors Forum, with the National Economic Council, and with the President's direction. We are tightening up the fiduciary system so that when we disburse 50 billion by the end of this first quarter of 2024 to the primary healthcare centers through the MPHCDA gateway or the NHIA gateway, the resources will indeed reach Nigerians and will be subject social accountability measures.
Speaking on unlocking the healthcare value chain, the health minister says 3 foreign entities will soon be coming into Nigeria for the establishment of pharmaceutical production companies to boost the local manufacturing of medicines.
We have at least 3 entities that are coming in to Nigeria. A Brazilian company committed and has approved $240 million investment in the generic pharmaceutical industry. And we have diagnostic companies that are coming to establish manufacturing plants. We already have one that is established in Lagos, which we launched in December. And in addition, our local manufacturers, local pharmaceutical manufacturers, we engaged with them in Lagos, we engaged with them in Kano, and as we speak, the President had directed the Attorney General of the Federation to develop an executive order on the policy measures to reduce the barriers for them to manufacture, to protect the industry that we have, while reducing also the cost of pharmaceutical, which is biting alongside the cost of many other commodities and inflation that we are facing as a country.
While underscoring the importance of preventive and curative measures against outbreaks and non-communicable diseases in Nigeria, the Minister of Health and Social Welfare also highlights plans and efforts to mitigate outbreaks in the country. He also says more tertiary hospitals as well as diagnostic centers have been earmarked for development.
This year there are reported outbreaks, but we are able to, with our partners, sense where those outbreaks and mobilize. And in fact, before we came here today, we are trying to mobilize vaccines for the meningitis that came out in Yobe State, for instance, where to mitigate it so that it doesn't spill over. Very soon, we'll launch a team that will be conducting an intense effort, and we have it in our 2024 budget, to begin to use digital technology to leapfrog in our health sector. That will be a collaborative effort by different parts of government, including the Ministry of Digital Economy, and my colleague, the Honorable Minister of State for Health, will be leading that effort.
As the Tinubu administration gets towards improving the healthcare sector, experts have advised the government to ensure the judicious use of all funds released and work to strengthen reforms in the healthcare sector. Olije Wapera, Arise News.